Hello, my viewers. Today I'm going to talk about preconceptional care, and I have already in my previous video I've defined preconceptional care. But today I want to ask a question: why is it important for a couple or an individual to go through preconception? Why preconceptional care important? Please put your thoughts in the comments section. Like and share the video for others to benefit. For preconceptional care, it refers to a care given to a care and guidance, medical guidance given to an individual or couple who are intent to conceive. And the main goal for preconceptional care is to improve the outcome of the mother and the fetus, and to address the risk factors that may occur after the pregnancy. That is why preconceptional care is very important, to address the risk factors that will occur before pregnancy. So for a quality preconceptional care, there are history to be taken, and the history is family history, medical history, gynecological history, lifestyle history, nutritional history, so many history that you have to take. Infection, menstrual history, occupational history. So those ones I will take time to explain them into details. I'll be taking them one by one to explain. So the medical history. The medical history is to know whether the person, the couple or the individual has a chronic disease like diabetes, hypertension before the pregnancy. So you screen to rule out all these things before the person conceive. And if you examine the person medically and the person is having diabetes or hypertension, the person need to be cancelled, because pregnancy increases your blood level small. So being hypertensive already, you have the risk of even having stillbirth, miscarriages, or even the risk to the mother going to preeclampsia or eclampsia, because already pregnancy has its related conditions. Some people are there, they are not diabetic, they are not hypertensive, but after conceiving, you will see that their blood pressure is going high, and after conceiving you see that their glucose level is increasing, and we call it gestational diabetes, or their BP is going high, we call it gestational induced hypertensive. So to rule out all these things, you have to go through preconceptional care to know whether I am at risk of going through this. And in this case, if you are already a BP, having hypertension, it is a special care you have to go through before you can conceive. If you are diabetic, because they have consequences to the baby and to you, the mother, the expected mother. So you need to go through this so that to avoid risk, because in the olden days those things weren't there. People were dying during pregnancy. Somebody can have pregnant and die with the pregnancy. You wouldn't know the outcome. But now study has made us know that we have diabetes who can cause it, we have hypertension who can cause all these things. So if care is not taken, the mother can lose the life or you can lose the baby. So proper care, that person will be taking very good care. And the family history too, we have genetic, the SS, the AS, and all that. So we have to check whether the individual is SS, whether the couple, one is SAA and one is SA, or they are all ASAS. The risk of the baby being a sickle will be high. If they are all ASAS, one baby will be sickle. They will deliver a baby who will be SS. Or you check if one is AA and one is AS, possibly you will get AS baby. So we'll do genetic test, that is the family history, to know genetically is there any condition that will affect the baby. Is there any condition that after delivery will affect the fetus? And the gynecological history, we will take a history to know whether the woman has done abortion before, has gone through surgery concerning the reproductive organ for both couple, but for the abortion is for the female, the woman, or there is any gynecological condition that any of them is having. We'll go through that, take semen, we'll do vaginal swab, we'll do cervical smear, and all that to rule out any gynecological condition, which is the HIV or AIDS, STIs, to rule out all these infections. So do blood, full blood count, vaginal smear, cervical swab for the woman, and the man will take the semen for test to know whether the semen can produce a child. And we have menstrual history. We also take the menstrual history of the woman, whether she is menstruating normal or she's having any abnormality in menstruation, the duration, the flow. We will take all this history so that comprehensive preconceptional care can be taken. And also we need to go through, ask the woman whether she was in conception, contraceptives, maybe any of the family planning method she was using, or she was using this our postnode 2, abusing it. Meanwhile, in the whole year, you're supposed to take it 3. Postnode 2, if you want to take postnode 2, is 3 thrice in a year. But our nowadays youth abuse it. The moment they meet with a man and they know that, oh, I might conceive, they go and buy postnode 2, but they don't even know the risk involved. So we'll ask you which of the contraceptives you have used and how frequent you used it, to help us give you a comprehensive preconceptional care. And we have nutritional care. That is when we now put you on folic acid, vitamins, and the rest. Calcium, you need vitamins, calcium, iron, to prepare the womb for conception. So the folic acid helps us prevent needle defect. See, so it helps us to prevent needle defect. So we put you through that for the period of the 3 months to the 1 year before you conceive. Please like and share this video for more. Thank you. And lastly, counseling. Counseling, because if you will notice that the client is having any condition through the examination, through the process, from medical, gynecological, family history, all that, you got to know that there is one of them that is having a condition, or one of them is having a problem, then counseling will be taken and treatment will commence to prepare them. After treatment, they can start conceiving. But for the preconceptional care medication, it is constant for the woman to be taken. The folic acid, the iron, the calcium, they are all good for the woman to prepare the womb for conception. So thank you for listening and for watching me. Like, share, and comment. Thank you.